Aloha. Thank you for watching the Fontaine Factor this evening. My name is Representative George Fontaine, and tonight we're going to be talking about a very important issue, not only for the state of Hawaii, but really the whole United States. And that important issue this evening is diabetes. This is a huge problem. It affects so many lives, and it really can be a silent killer. So we have some very special guests this evening who will talk about diabetes, what the scope of the problem is, early detection methods, and ways that you can help prevent getting this terrible disease, and what are some of the ramifications if you do in fact have diabetes. So anyway, I'd like to introduce my first guest, which is to my immediate left, is Representative Corinne Ching. She represents House District 27, Nu'uanu, Pu'unui, Liliha, and let's see, that's pretty much it. Okay. And to her immediate left is Leslie Lamb, who's the Executive Director of the American Diabetes Association in Hawaii. And to her immediate left is Viola Genadio.
Yes.
I got it right.
You got it right.
All right,
yes.
Terrific. And she is also with the American Diabetes Association as well. But she's, more importantly, a registered nurse and is, I guess, actively involved in prevention efforts throughout the state.
Actually, yes, I'm actually a certified diabetes nurse educator, and I'm also board certified in advanced diabetes management. And I've worked with people with diabetes for many years, and up until, actually till December, I worked for Hawaii Medical Center, and I was actually a diabetes clinical nurse specialist. And I continue to be involved with the American Diabetes Association and actually on their board, and also has a volunteer for many years.
Well, terrific. We're glad to have your expertise, and I want to thank you all ahead of time for taking the time out to come on to the Fontaine Factor and share a little bit of your knowledge about this horrible disease that exists in our state. Folks, what I'd like to do at this point is I want to roll a video. It's about 3 minutes, and I think that will help kind of set the pace and of what we're going to be talking about tonight. So if you could go ahead and roll that.
Got the news today. Doctor said I had to stay a little bit longer and I'll be fine. When I thought it all been done, when I thought it all been said, a little bit longer and I'll be fine. But don't know what you got till it's gone. Don't know what it's like to feel so close. And every time you smile, your laugh, you glow. You don't even know, no, you don't even know. All this time goes by, still no reason why. A little bit longer and I'll be fine. Waiting on the cure, but none of them are sure. A little bit longer and I'll be fine. But you don't know what you got till it's gone. And you don't know what it's like to feel so low. And every time you smile, you laugh, you glow. You don't even know, no, you don't even know, no, you don't even know, no. Don't know what you got till it's gone. And you don't know what it's like to feel so low, yeah. And every time you smile, your laugh, you glow. You don't even know, yeah, So wait till kingdom come, All the highs and lows have gone a little bit longer, and I'll be fine. I'll be fine.
Beautiful video. I'm glad we shared that with everyone. So let's talk about the scope of the problem of diabetes, not only here in the state of Hawaii, but in the United States. Leslie, can you give us kind of an overview of how bad the problem really is?
Sure. There's about 26 million people with diabetes that are over the age of 20 in the United States presently, and about 79 million of them have prediabetes. This is a disease that is very important. It's climbing every year, and it can be preventable. So those 79 million with prediabetes, those are the ones we really want them to make a change in their lifestyle.
What is the numbers for Hawaii?
For Hawaii, it's 113,000 people here with diabetes. 28,000 are undiagnosed just yet. We have 20,000 Native Hawaiians who have diabetes.
That seems like a big disproportionate
Yes,
number.
yes. Native Hawaiians, Japanese, Filipinos are at high risk here in Hawaii. Throughout the U.S., you can add Hispanics and African Americans to that mixture as well. So, you know, your ethnicity really plays a part for diabetes 2, type 2.
So Viola, is this a disease that's inherited, or is it something that's caused by poor eating habits or diet, lack of exercise?
I think you could say both, and I just wanted to go back when we talked about pre-diabetes and the different types of diabetes, and Leslie had mentioned the pre-diabetes, and that's where we can make the difference. It tends to run in families. We know there may be a genetic component to that, and I think when you look at the types of diabetes, type 1, type 2, type 1 is not the common one that we see. That's probably 5 to 10% of all the people that we're going to see. So we're really looking at that type 2, which is 95% of all the people that we do see with diabetes. And when you look at that group of people, we're looking at, like we say, lifestyle changes. A lot of it could be runs in families. I mean, there's information that we have that if you're at high risk for it. And then again, going to when we look at, like you mentioned before, obesity does play a role in it, the diet and exercise. Those are all components. You can have risk factors. And some of those risk factors you can change, but there's some that you cannot change. And so you need to focus on how we can change those. And so having this program today, I think, is wonderful, bringing the information out to people so we can work on trying to change some of those risk factors. Because here in Hawaii, we know that we don't see the numbers going down. I think locally, also nationally, those numbers seem to keep going up. And every time I look at statistics, it's like every year, every few years, we're changing those numbers. So in Hawaii, over the years, it's gone up too. And
there's also gestational diabetes as well too.
Yes.
Isn't that correct? With pregnant women?
That's correct. So we mentioned there's 3 types of diabetes we look at. Type 1, we just mentioned type 2. That third one is gestational diabetes, and that occurs during the pregnancy. When the woman is pregnant, she develops diabetes during the pregnancy, but when the pregnancy is over, the diabetes goes away. The problem is that the risk factor for developing diabetes does not. So some of the studies will show, or the data, that the woman will probably develop diabetes in several years. So we still need to focus on that too. And you can do all the right things and it can still occur, but that woman is at high risk. And so that's another person that can develop into type 2 diabetes.
So if a person is developing diabetes, and please feel free to jump in on this question, but if a person is developing diabetes, it's not like you're coming down with a cold where you have symptoms per se. Is that correct? It's something that happens over a period of time, and then by the time you do actually show a symptom, that it's usually too late. Like usually you're going to have kidney failure or some other health issue. Maybe you could explain that a little.
That's a very good question, because when you look at type 1 and type 2, with your type 1 diabetic or person with diabetes, usually those symptoms can be more, they can come on very suddenly sometimes. You know, you may be sick for a while, and sometimes we see that commonly in children where it comes on suddenly, they get sick and they, you know, they have a weight loss. But with type 2, you can actually have type 2 for several years and just not know you have it. And so some of those symptoms may be very subtle. And so, for example, you just may feel tired, and you may think, well, I'm getting a little older, so maybe it's just me, or you may your vision may change, and you may think, well, I may need glasses, or you may notice you get a cut that doesn't go away, or a symptom that drives you in to see the doctor. And I know working in a hospital situation, sometimes that first encounter may be a heart attack. You didn't know you had heart disease or a heart attack until you come in and you've had that heart attack, and they test you and you find out you have diabetes. But the more common symptoms that I have seen with people with type 2 diabetes is usually thirst and urination. Those are very classic. And sometimes it's hard to relate to something too, because if you're taking medication that makes you go to the bathroom, like a water pill or something for blood pressure, that may make you want to go to the bathroom a lot, and you may not connect the two. Or getting up during the middle of the night, frequent urination, going to the bathroom. And we're talking about where you're getting up every 2 or 3 hours, you get no rest. And sometimes that will bring you into see the doctor. Or for women, it may be a yeast infection, may be something, or for men it may be an erection problem that may take them in to see the doctor, that may be a clue. And I think too, we're also seeing it with younger and younger people, because we used to say it tended to be over the age of 40, 30, but now with kids we're seeing symptoms of type 2 diabetes.
So what would be your recommendation for our viewers that may be experiencing some of those things that you just mentioned? What should they do?
What should they do?
Yeah, I mean,
if you're at risk, especially if you have a family history, chances are you are at risk. And those are things I think you need to discuss with your doctor. But it's a very simple test that they do. It's actually a blood test, and it's something, if you have an annual physical, there's a list of risk factors, and I know that the American Diabetes Association puts out that list to see if you are at risk. What they do is a blood test, and what you really need to do is fast for 8 hours. And that's really important, because when we look at blood sugar ranges, you can have an elevated blood sugar and not have diabetes. But the fasting, you go in, they do a blood test, and sometimes the doctor will do it on 2 occasions, and they're looking for a certain number.
And they also do, I think, a glucose test, right? Where they
or
make
glucose tolerance test,
yeah,
yes.
drink that.
But that takes a little longer to do, and some people don't like to wait around that long. So that's another way that you can diagnose it. And there's a couple ways. Blood test is one, and we're talking about going into a lab, not actually using the blood glucose meter, because that's just a screening tool, and that will just let you know if your sugars are abnormal. You really need to have a blood test done. But they can do the oral glucose tolerance test. It takes a little bit longer. Or if you feel that you're having the symptoms of diabetes, thirst, urination, run down, not feeling good, you can just go in and you can do a random blood test. And if your blood glucose is greater than 200 milligrams, then you pretty much, it's likely you have diabetes.
Folks, if you're just joining us, you're watching The Fontaine Factor, and tonight we're discussing diabetes, the silent killer, but not only in our state, but also nationwide. And we have 2 experts, one from Executive Director of the American Diabetes Association, Leslie Lamb, who's in blue. And we also have Viola Genadio, who is a registered nurse and certified to do diabetes.
I'm a certified diabetes educator, CDE.
And to my immediate left is Representative Corinne Ching, who's doing some fabulous work here at the legislature and pushing this issue forward at the Capitol and looking at ways that we as a government and as a body can help tackle this important disease. Leslie, I wanted to ask you, what does the American Diabetes Association do? Obviously diabetes prevention and awareness, but maybe you could get into some specifics about your organization.
Our mission is to prevent and cure diabetes and to improve the lives of everyone who has diabetes. So what we try to do is put as much money as we can for funding for research. About $550 million has already been given to research. Unfortunately, there is no cure. So what we try to do in our own sites, Hawaii, in our own neighborhoods, is provide programs. So we have programs for the newly diagnosed, and we have a very robust program called the Living with Type 2 Diabetes. It is free, and it is where we will give knowledge. If you sign up, if you're a caretaker, or if you've been newly diagnosed with diabetes, or if you've had diabetes for a while, and you're only now ready to say, okay, I'm ready to make the change, then you enroll in this program. We immediately give you a t-shirt, a pedometer, and a book, A to Z, about everything you can learn from A to Z about diabetes. And then every 3 months, we give them a pamphlet of information that talks about, what do I buy at the grocery store? And how do I count carbs? And how should I integrate exercise? into my lifestyle? And should I be ashamed of it? How should I worry about this? What if my children get it? I mean, it really takes you through all of the emotional aspects so you can manage diabetes. That's just one program that we have. We have many other programs. This year, we are so happy to work with St. Francis Hospital. We're going back into the schools and teaching the 4th and 5th graders about diabetes education, and we're so excited to do that. And we also have programs for adults. We have an adult support group program once a month at our office, and we bring in a speaker for that. Once a year, we have, and Viola is one of the committee members, very successful professional education symposium, where we bring in professional diabetes speakers or endocrinologists. And they come from the mainland, and they come here to teach our professionals what is the latest and greatest about diabetes. And we also have local speakers that are at the top of their fields, and they come and they speak as well. And so we're very robust in getting information out and education. So that is our main priority, is getting people aware of diabetes. Awareness is the key, and prevention. Because if we don't, if the trends continue, following up to what Viola said, 1 out of every 3 children will end up developing type 2 diabetes by the age of 30, and that's a national standard. But because of our ethnicities here in Hawaii, it's 1 out of every 2 children.
Wow.
Do you have any children?
Yes.
How many children do you have?
2.
You have 2. So if trends continue, any child born after the year 2000 will be diagnosed with type 2 diabetes. So we have to get the awareness out, and we have to let people know that prevention is the key. Yes, we were told that there's no cure yet, but how about if we look at it as, if we prevent it from happening, wouldn't that be part of a cure as well for type 2 diabetes?
You know, the thing about it I've noticed, especially lately in terms of looking at, you know, food trends, it seems all about higher calories. Kids are bombarded by the internet, by TV, to consume, you know, I just saw one, they had the supermodel eating this burger ad on TV, and it's like, you know, oh, she's a supermodel, but she can eat that, and she looks really good eating it. You know, and it's not really realistic, because you look at like a typical hamburger like that, it's probably got about 2,000 calories in it. You know, it's crazy. And yet people see this, and we promote these comfort foods and things which go directly against a healthy lifestyle and living. And it frankly is so expensive to eat healthy. You know, and I think that's the problem too, is that when we talk about minorities, and many of them are working families, and to go out and buy fresh fruits and vegetables and to eat healthy is so difficult. And so how does an organization like yours help those to overcome some of those hurdles? Because somebody may make the decision and say, okay, I'm with you, Leslie and Viola, I'm gonna change my ways, and I'm gonna eat healthier. And now you hand them a meal program and saying, okay, well, you need to have so many fruits and vegetables, and then they look at it and they go to Safeway, and it's $3.39 a pound for a head of broccoli, and they go, I can't do that. So it's easier to get the can of creamed corn instead, which is 99 cents. So how do you overcome that part of it? Sure.
And I know that Leslie and Viola probably have their ideas too. You really touched on, Representative, the way I think it trickles down to the regular person with diabetes, and it's so true. You know, not long ago I started to look at the television programs, what you mentioned, and you know, just about maybe 15 years ago, I think maybe 20, the culinary arts took off, and that's a wonderful thing, because you know that Hawaii has some of the premier chefs. I mean, Roy and Alan, and that's a really good thing, because they're using healthy ingredients, and they're using it in smaller portions, and they are helping the farmers. And that was a big, important movement, the Hawaii regional cuisine. But what took off, I don't know how many years ago, was this fascination with food going on, not just culinary, but just food as an attraction that meant more than food. And sometimes I feel that in Hawaii, we almost have a language of food. You know, and we have our spam musubi, and we have our manapuas, and we have these things, and they become very convenient, as you say, and they're kind of a way of saying, like on the golf course, you've got a spam musubi, right? You know, you see it all over, and it's kind of a way of saying, you know, we do it different here in Hawaii. We're different, and we are different, and that's cool to be different. That's fine to be different, but when it's coming to the point where we glorify a type of consumption, which means, like if you look at our local television, having pounds of food piled on, it's almost a medal of honor, as you're referring to, you know, and you can see it on national television as well. There's shows that, oh, can you eat this huge hamburger, and the bigger the better. It's an American style. It's so far away from healthy. The French use real butter, but the fact is the French don't have big portions. They use real butter, they use real cream. And when I've seen them, they're very healthy, epitome of health. Where can we have a balance whereby we say, sure, we've got our local foods, sure, that's great. Plate lunch is great once in a while, but not every day and not in that portion.
Well, I know that for myself, you know, being here at the Capitol, you know, everything is like eat and run, and everything is about convenience. I really have to work hard to eat healthy, and I usually make my lunch in my office where I can control the salt and the proportions and what exactly that I'm eating. Many times when we're in caucus, I cannot,
Right.
and I have to eat whatever is available. But I think really this what really comes down to is that you know, not only the food portion as a way of looking at a healthy lifestyle. I lost 90 pounds about 4 years ago, and I've managed to keep it off. And at that time I was pre-diabetic. And now I have no traces of having anywhere near close to being a diabetic anymore. So I think I got there in time and lost the weight before it became a real health issue for me. But the key is that I went to the doctor. And I think people, as they start getting into my age, and maybe they're overweight, or maybe they're not feeling so good, and I think in the back of their mind, they're thinking, you know, I think there might be something wrong. But it's like, if I don't know about it, it can't possibly hurt me, so I don't want to go and get bad news from a doctor. So they start not going to the doctor because they're afraid the doctor's going to tell them things that they don't want to necessarily hear. And
So
that's
true.
the problem, I think, that a lot of people have got to get over that fear and go down and get their annual examinations. And folks, most healthcare does cover you know, an annual physical, and it's worth it. If it means that you're going to get another 10 years of quality life to spend with your family and with your children and not be burdened by this incurable disease of diabetes, I think it's so important, you know.
Just wanted to bring up something. You mentioned pre-diabetes, and I want to bring that up because, like Leslie mentioned before, there is no cure. We can control it. But when you talk about pre-diabetes, this is a point where we can make a difference, and this is where you can slow down the progression because you don't have it, and this is where you can make that turnaround. And what you've done is you've actually done some changes which has turned that around, and so that's where the research now is being done. So we know that if we can do something in that point before you actually have diabetes, that's what we want to do.
You know, and it was really hard for me to make that I mean, it was really hard to change a habit that I have been doing all my life, was eating poorly, and to make that change. Now, I went to a nationally recognized weight loss center and joined that program, and that's always an option for people. If you can't figure it out on your own, get some help with these other national programs. There are many of them, and I'm not going to name them because I don't want to endorse anybody on this show, but there are some very good ones that have dietitians. They'll work with your doctor, and they will help you get through this program.
Right.
Representative Ching,
Yeah.
you have been like the leader at the Capitol on this issue of diabetes and prevention, and you have done a number of bills about that. I know you had a tremendous bill that was moving forward this session. Unfortunately, it died in finance, which tends to be the graveyard of all the bills that don't move through. I don't know why there was a financial impact on diabetes, but there was apparently. It went there, and there it died. But I know that you are going to continue this fight, and maybe you can tell the folks what it is that you were working on and what you were trying to get through with your legislation.
Thank you so much, Representative. Well, maybe, did you want to hear, I lost a very good friend to diabetes, and she wasn't even heavy. She worked here at the Capitol. I met her through the district, walking the district. She was a constituent of mine, and she became a very close friend. And it was amazing how quickly she deteriorated. So I got a close-up view of diabetes and how shocking it was. And I vowed, after she passed away, I vowed that I would take it on.
Okay,
And
so your bill.
yeah, it was relating to diabetes.
Okay.
It was originally for a czar of sorts to be someone within the Department of Health to just really sort of laser beam in on this issue, aside from chronic disease or obesity, to say laser beam diabetes. But then it was amended in health. It made it through the health committee. We're very happy about that, to a task force, which was fun. You know, we felt that's a good beginning too, and we hope to reintroduce it next year. And it's a task force, but to again laser beam this concept that Hawaii people, as we said, the minorities of the Native Hawaiian, Filipino, Japanese, this is all around us, and it's worthy of our priority at the legislature to really understand this disease, to understand it's a silent disease, that it could be prevented, as you have done, and ways to go about it. And did you want me to mention my...
Sure, we have about 2 minutes left, so
okay.
yeah, if
Real
you
fast. It's based on some of the things that I learned at a conference through Thrive, the Blue Zone Project, which is based on, as you said, convenient access to fresh fruits and vegetables, farmers markets. Number 2, clean environments, encouraging people to walk around. Number 3, civic events to get people to come together. And it's to launch it, we have a Green Anthurium project. We call it GAP, the Green Anthurium, and it's kind of like the Pink Ribbon Project to say, you know what, eat green, be loving to yourself and others, and you'll live a long time because it's a long-living plant.
Leslie, if people want to get more information about the American Diabetes Association, you have a website. How do people contact you?
We'd love them to call at 947-5979 or go to our website. We have a local website here at diabetes.org/Hawaii.
Okay, people are seeing that. That's good.
Good, and I'd like to just put up, if this is possible,
Sure.
this is the risk test that we'd like them to go to our website and take. So we have an online version, and we invite everyone to go to our website, take the risk test, and if you are at risk, please give us a call, and we will walk you through the process.
Okay, and
Very good.
if you also have some seminars or health fairs coming up, you want to talk about that?
Yes. Viola is actually one of the directors, along with Dr. Lori Tom. Would you like to?
Yes, just
talk
want to
about
mention
that?
this. This is called Take Control of Your Diabetes, and it's a wonderful conference. It's very motivational. We've done it. We do it here in Honolulu once a year. It's actually Steve Edelman.
And what is the dates? Because we have less than a minute left.
It's actually April 14th, which is a Saturday, and it's going to also be in Maui on April 15th. It's a half-day conference.
So can they go to the
Wonderful speakers.
website to get that information?
Yes, they can.
Perfect.
Yes.
Well, folks, I want to thank you folks for coming in. I think this has been very informative. I know this time went by very quickly, but you know, I really appreciate you folks taking the time and coming in here and sharing us on prevention, ways of detecting, and how to look forward. Folks, if you have any questions about this show or comments about any of the other shows, please write me at repfontaine@capital.hawaii.gov. That's repfontaine@capital.hawaii.gov. I'll be more than happy to answer your emails and letters. We did get some very nice letters about our show about human sex trafficking. If you didn't see that show, it is up on YouTube. You can watch it. So again, thank you to all for listening.